Hi, hello everyone. This is Forrester Pack, aka the Four-Star Troubadour, and you are watching or listening to Your Healthcare Future, WFNU 94.1 Frogtown Radio, and viewers on our HCAMN websites. Today, I am glad to be speaking with David Sandbeck here in studio. How are you doing today, David?
Doing good. Thank you for the invitation.
Thanks for coming, and we're just going to be talking about healthcare a little bit here, as well as your candidacy for the CD4 seat here in Minnesota.
Thank you.
Just before we kick off, we just want to let everyone know, of course, this isn't an official endorsement. This is just a conversation. We're glad to have David here, and let's go forward. So, David, could you tell us a little bit about yourself?
So, I'm David Sandbeck, and I work for the state of Minnesota. I've worked on all kinds of projects related to the MMIS system that processes claims for Medicaid and Medicare, projects related to that, infrastructure projects. But also, I'm somebody who is passionate about being an active citizen and how important that is. And so when we have politicians that represent our district, but we don't have the benefit of a competitive primary, I think we all lose a little bit. And so I felt the need to do something about that in the 4th Congressional District.
Right. One of the big issues that are probably coming up in your campaign, as well as other campaigns around the country, is healthcare. So our first question for you is, what sort of healthcare stories have you heard from voters since you began your campaign?
So there's a lot of similarity, and a lot of it has to do with cost, affordability, and that word gets tossed around a lot. And I wonder what affordability means when half of the country's living paycheck to paycheck. What's affordable? And the cost of health care is going up and up. And so, I'm a part of a union, and the negotiation process for our compensation, a lot of the conversation is stuck on the cost of health care. And so maybe we don't get much of a raise, but our health care costs are contained somewhat because the cost of health care is going up faster than the cost of inflation. So there's those kinds of stories, and then there's the really sad stories where people in my family were forced into bankruptcy because of healthcare costs and unplanned costs, and people who limited their own access to care. I've spoken with people who've lost loved ones because they rationed their medications. I've spoken with people who lost loved ones because the medication was bad. We don't do the kind of inspections that medications need. A lot of these medications come from China. They're produced in China. And, our federal inspectors, we don't have much authority in China. And so we've given these corporations a monopoly. You think they'd have a little more patriotism and at least develop some of these drugs here in the United States where we can do some quality control. But there's no patriotism in these corporations, and Americans are suffering as a result.
Some stats from our organization, Healthcare for All Minnesota. Since 2017, the average insurance premium for a Minnesotan has risen 50 to 67%. For Minnesotans of color, insurance rates can be 3 times higher than for white Minnesotans, and 2/3 of all bankruptcies are linked to illness and medical bills. And you just alluded to that when you were talking about what you've come across while you're campaigning.
So it's new information for my ears that people of color have higher insurance rates than other people like myself, and it's already unaffordable for people like myself. I think about my experience in just a 20-minute visit with a general practitioner, a planned visit, cost me $300, and then I think about I have that experience, and someone could be paying 3 times the cost for their insurance plan to get care. It's obscene. That's the word for it.
And as we know, CD4 is represented by Congresswoman Betty McCollum, your opponent, and I believe she's been in office since about 2001. We pulled a quote from Representative McCollum's website with her stance on healthcare payment reform. And what she says is, I strongly support creating a public option in our healthcare system, efforts to address health disparities, and policies that will address the rise of prescription drug costs. We must also do more to ensure all Americans have access to mental and behavioral health services. To fulfill our goal of a true universal healthcare system, I have proposed the America's Right to Healthcare Amendment, which would enshrine a fundamental right to healthcare in our Constitution. And again, this is from her website and from a press release when she did the amendment back in February of 2017. Mm-hmm. Now, I know you know this. A lot of our listeners and viewers out here probably know this too, but constitutional amendments take quite a while to pass.
They sure do.
Healthcare is a very urgent issue. So I just wanted to get your take on her reaction to how we should handle it.
So at least she has something to say when people ask her, what are you doing about access to healthcare? And she can talk about making it a right. A constitutional right. Oh, that sounds wonderful. We don't need to change the Constitution. We can create a law like H.R. 1384, and it would be wonderful if Betty McCollum would co-sponsor that. So a public option would have been great 10 years ago. That might have been a great first step 10 years ago when we had Democrats in the House, Democrats in the Senate, and Democrats in the executive branch. I wonder why we didn't have a progressive champion to advocate for at least a middle ground. Instead, we get hundreds of pages, probably written by lobbyists, passed through Congress. And I look at that, and it was a Republican plan. First started as a thought process out of the American Heritage Foundation, implemented first by Republican Governor Mitt Romney, Romneycare, and then we started with compromise, with a middle ground. So I think about, we didn't even get a public option 10 years ago. 10 years ago was the time to maybe get that done. We're way beyond that. Healthcare costs are insane. It's only going up and up and up. It's only going one direction. So if you have a crystal ball, you can throw it out, because the best way we can predict the future is looking in the past. And we can see this. The cost is going up. And the only way to control that is single-payer healthcare. And that's going to allow us to use the ultimate collective bargaining tool. Everybody's in. Nobody's out. This is a market-based solution. This is going to allow us to offset the artificial monopolies we've created for the healthcare industry, the pharmaceutical industry included. So we give them patents, they abuse their patents, they extend their patents, and so how do we deal with that? Well, if we can collectively bargain like Canada does, like the rest of the wealthy nations can do for theirs, we can do the same for ours. So under a single payer system, what we can do is contain these costs. And unfortunately, sticking with the status quo, sticking with a middle ground, creating another health insurance plan that insurance companies are going to offload their expensive patients towards, isn't going to solve any of the waste, fraud, and abuse that's in the system. The only way we're going to take on this waste, fraud, and abuse is with a single payer, guaranteed payer system.
To your point about single-payer health care, and you had just mentioned this H.R. 1384, Representative McCollum hasn't signed on to this bill specifically. It was presented by Representative Pramila Jayapal out of Washington State. It's a Medicare for All bill, and it has 117 sponsors, including Ilhan Omar. So you just talked about this. If we could just get your stance on H.R. 1384, personally.
We absolutely need a representative who is going to be a champion for single-payer health care. And that means we need Betty McCollum to co-sponsor single-payer health care. She's co-sponsored it before, I think in 2013, and hasn't co-sponsored it since then. I've attended town halls before. Her concern had to do with indigenous health care rights for Native persons and fully funding the VA. This bill, 1384, addresses those concerns that Betty has talked about. So it's time we get someone to step up to represent and take full advantage of one of the most progressive districts in the country. And it's disappointing when we're not leveraging the full potential of this district. It's being squandered. We didn't hold ourselves accountable, our party accountable in 2012 when we had in 2010 rather, when we had control of the House, the Senate, and the executive branch. We didn't take full advantage of that, and so we can't let that happen again. And a competitive primary is going to demonstrate to our incumbent that this district will stand behind a progressive stance, and so we need Minnesotans to get out and caucus on this issue. It can be Healthcare for All Minnesota, John Marty's bill. Go out and caucus, talk with your community, talk with your representatives, and the caucus process is a wonderful way to do that. And you can become a delegate all the way to the district caucus, and that's where you get an opportunity to help create a competitive primary for someone like myself. That's going to give me the opportunity to leverage a party endorsement to create a competitive primary. And so if this is something you're passionate about, as I am, that's the tool that we can use to do something. People are always wondering, what can I do? That's something you can do. You can get involved. You can caucus.
And David, your passion for healthcare is a bread and butter issue for us as individuals, employers who have to often carry the load on insurance costs for their employees, but also for unions. Just before we began the interview, we were talking a bit about an experience you had with one of the largest unions in the state of Minnesota, MAPE, and how healthcare played a part in that. For our listeners and viewers, could you maybe talk about that for a little bit?
Yeah.
Sure.
So we get to set an agenda. What are our legislative goals? And part of that is we create a committee, a political committee, to establish what are those goals going to be. What are we going to focus on? And I was so heartened that many of the MAPE members are really concerned about healthcare. They're very passionate about it. And a lot of us work for Department of Human Services. I'm a minute person in DHS, and I hear about the passion, and I experience the passion of the people that work at DHS every day. And I'm certainly heartened by all of the concern for Minnesotans and for Americans about their lack of access to healthcare, affordable healthcare. And like I say, what does that mean? But almost everyone on that political council talked about healthcare and how important it is that we do something about it. And so, the unions are out there. They're out there making it happen. The nurses are out there making it happen. At the state fair, you're going to see the nurses out there if you haven't already. They're out canvassing. They're out door knocking. They're getting it done. And so a lot of the organized activities are being led by unions. And so I'm making sure I'm doing my part as a MAPE member that we acknowledge the work other unions are doing, and we join them, and we support each other in making healthcare the priority. So something else that's really important is that's going to be for all workers. So there are people out there that saying, unions might oppose a single payer because they have good benefits and they don't want to lose what they have. That's really not the case for most people I've been talking to in unions. I go out there and, they like having good benefits, but they want all Americans to have good benefits. Unions, we want to be there for all workers. And I've talked to small business owners, and healthcare is a big concern. They can't afford these costs. They can't compete with the big industry. And the big industries that are the big employers, they don't like the unpredictability of healthcare. Ford created a plant in Canada, and a part of their notice to shareholders, one of the benefits of opening and creating jobs in Canada was their single-payer system, that it contained costs. It became a fixed cost that they could account for. And that's just not the case here in the United States.
And that's one of the biggest things with single-payer healthcare, right? Employers would save enormous amounts of time and money without having to negotiate with private insurance companies. The employees would have lower costs because we would have no need for deductibles or premiums. So those are just some of the many benefits of a Medicare for all or single-payer healthcare system. As we kind of wrap up here, did you have any messages for voters in CD4 about healthcare going forward and what I guess they can expect from you as the race continues?
Yeah, healthcare is the big issue. That's the number one issue that I'm running on as to why I'm running for the 4th Congressional District. Another big important issue is public financing of elections. The way we finance our campaigns is basically the root of all evil. And the way we can deal with that is public financing of elections. And the other big thing is taking on the military-industrial complex. And so it has embedded itself in almost every district in the country. Our own incumbent representative, one of the largest contributors, includes Raytheon, Northrop Grumman, General Dynamics, and these are companies that are laughing at us all the way to the bank. And it's time we do something about it. Over $700 billion for defense spending. We're actually less safe. We have less military tools to keep ourselves safe. These endless regime change wars are making us a target. It's giving radicals a reason to hate us. And unfortunately, our incumbent has supported proliferation of these regime change wars. For example, Libya, there was a vote and our incumbent voted to do regime change in Libya, and it's been a disaster. We didn't learn, or at least our incumbent didn't learn, from the mistakes we've already made in the Middle East. So there's a number of issues that I'm passionate about as for why I'm running.
And you actually brought up another great point, and I'd be remiss if we didn't go back to it. The factor of money in politics in regards to healthcare. We know this because single-payer healthcare and Medicare for all generally pulls very well with the public. But when it comes to our elected lawmakers, you haven't seen any action since really Obamacare, as you mentioned years ago now. What do you think about the influence of big pharma and drug manufacturers who continually go to both the state capital here in Minnesota, I'm sure in Washington, D.C., they have big influence? Do you know if there'd be a way to get around that, or do you have any solutions in mind for how we can combat that, the influence of money in politics?
So we have to get all of this corporate cash out of the process, transitioning to a public finance system. In Minnesota, we have a small process to try and offset the influence of this. We have a plan where you can contribute to state and statewide representatives and your congressional representatives, your state house representatives, $50, and you can get a reimbursement. There could be expansion of that at the federal level, but the real thing is getting down to one person, one vote. And how can we do that from a campaign finance perspective? We have to empower people to contribute to candidates they believe in. So we have to expand a system like that, and that means limiting the ability of the 1% to buy and own our representatives. They're subverting our democracy, and it's time that we put that to an end. So there's one really big example I think we need to talk about, and that is over 90% of us, 90% of America, we wanted justice when they collapsed our economy. Okay, the big financial institutions, we didn't get it. Why didn't we get it? We had Democrats in the House, we had Democrats in the Senate, we had Democrats in the executive branch. Why wasn't that a scandal? It's a scandal to me that we didn't jail these people, that we didn't hold these financial institutions accountable, like Credit Suisse. If a small bank had done what they did to evade taxes, that bank would be shut down. Those people would be put in prison. We didn't do this for the people that collapsed our economy. And why? Because institutions like Citibank were huge campaign contributors, and it's only getting worse. Over $7 billion will be spent in 2020 to buy the federal offices in 2020. So this is getting worse. It's time we take this on.
And we see this example in the healthcare realm with insulin costs, with drug costs, how the corporate leaders, the boards, the heads of a lot of these companies are perfectly fine raising prices for no apparent reason. And the public really has no recourse because, like you said, the influence of dark money in politics, campaign contributions, it's to such a degree now that there really isn't much we can do unless we have candidates like what you're saying that are actively fighting this scourge.
Absolutely. So we know that the original patent for insulin was sold for like $1. And I think about people that are critical about, what's going to happen if we do single payer and we cut and we stifle innovation somehow. I think about Jonas Salk, the man who discovered penicillin. And when he was asked about patents, he retorted, "Would you patent the sun?" There are people out there who are inspired to innovate, and it's not just about dollars and cents. There are people who are passionate to innovate, and a lot of that innovation happens with public financing, and then we sell it at a discount to the pharmaceutical industry to sell it back to us at obscene prices. So again, it goes back to single payer, and that's how we hold them accountable. That's going to give us the opportunity to collectively bargain for a better price.
David Sandbeck running for CD4, Congressional District 4, and Any final messages of what was out there? Sorry.
Messages? Sure. There's a lot of talk about immigration, and I'm going to tie it in with healthcare because that's kind of the thing here. But my dad, when he was on his way out of this world, I was so grateful to the people that helped him in long-term care. And it was because of Medicaid that he could depart with dignity. And the only reason he could depart with dignity is the man had nothing to qualify for Medicaid. You have to be broke. You have to be poor to qualify for that. And I saw families that didn't, and they were being torn apart financially. And so I see it, I saw it, and also the people that delivered the care in long-term care. A lot of them are people of color. And I want to talk to, if you're an older person, who's going to be there to do that work? If we are demonizing the people that are going to be, that are the ones that do this, I was so grateful that there was someone there to do the work I couldn't do, and maybe work that was so unpleasant, maybe it's not something parents would want their children to do, but there was someone to do that, and a lot of those people were people of color. And so I look at immigration as a human right, just like healthcare is a human right. People move. Movement is life. And I respect life, and I respect people of color. And I am so grateful for what they did for me, for my family, for my dad, giving us dignity on his way out. And so that's the last thing I'd want to share.
All right. Thank you again for coming for our interview today, and good luck in your race going forward.
Thank you.